So today we're going to be talking about the strategic prevention framework planning step and how it relates to the community health assessment process. So a community health assessment is a systematic process involving the community to identify and analyze community health needs and assets, prioritize those needs, and then implement a plan to address significant unmet needs. A community health assessment is always centered around community engagement at every step. Now, SAMHSA says the purpose of the SPF planning step is to increase the effectiveness of prevention efforts by ensuring that prevention planners select and implement the most appropriate programs and strategies for their communities. In an effective planning process, communities involve diverse stakeholders, replace guesswork and hunches with data-driven decisions, and create comprehensive, evidence-based prevention plans to address their priority substance misuse problems. Some key aspects of the planning step are prioritizing risk and protective factors associated with the substance misuse problems, selecting appropriate programs and practices to address each priority factor, combining programs and practices to ensure a comprehensive approach, and building and sharing a logic model with stakeholders. Planning is all about taking the prioritized issues that your assessment revealed and coming up with a plan to effectively enact change around those issues. You will utilize information from the assessment and capacity phases to inform your planning. The planning step relates to step 7 of the CHA process. Step 7 of the CHA process is to plan implementation strategies. As you can see here, the example has been filled out from the state's perspective. The implementation strategies included are the goals of the MI-PAC project. The objectives from the project that ensure these goals are achieved are also part of the plan. The assessment revealed our priority issues, and through the capacity phase, key stakeholders were identified and engaged. These strategies were developed by taking a few key aspects of the planning phase into consideration. We will touch on those key aspects throughout the rest of this presentation. So first, we're going to talk about risk and protective factors. Risk and protective factors are the first thing you should be taking into consideration when planning out your strategies. Every substance misuse problem in every community is associated with risk and protective factors. Risk factors are associated with a higher likelihood of developing a problem, while protective factors are associated with a lower likelihood of developing a problem. Some examples of risk factors are favorable attitudes towards problem behavior, low academic achievement, favorable parental attitudes towards problem behavior, or social norms that are favorable towards problem behavior. Some examples of protective factors are strong social skills, opportunities for pro-social involvement at school, attachment and bonding to family, and recognition of pro-social involvement in the community. You need to figure out what risk and protective factors are key drivers of the community's priority problems. Considering a factor's importance and changeability is how you will prioritize it. As you can see on this table, you can chart factors by their importance and changeability to categorize them. You want to focus on factors that are both high importance and high changeability. The factors in that quadrant are going to be the priority factors that we aim to impact with our interventions. Here are some questions to ask yourself when assessing the importance and changeability of factors. For importance, we want to consider how much the factor contributes to the priority problem. If it is relevant to the developmental stage of the focus population, and if it is associated with other harmful health behavior problems. For changeability, you want to consider if you have the resources and readiness to address the factor, if a suitable program or practice exists to address the factor, and if we can produce outcomes within a reasonable time frame. Again, we want to prioritize factors that are high in both importance and changeability. Sometimes no factors are high in both categories. In that case, we want to prioritize factors with high importance and low changeability, since important factors contribute significantly to priority substance misuse problems, and addressing them is more likely to make an impact. However, in some cases, a community may choose to address a factor with low importance and high changeability because doing this can give the community a quick win, helping to raise awareness, support, and community capacity to address more important factors. So now we're going to take a look at selecting appropriate evidence-based practices. When selecting EBPs, there are 3 important criteria that should be considered. The first criteria is an evidence-based foundation. Programs need to be evidence-based. There are extensive resources on finding and reviewing EBPs. Many resources contain extensive program listings and descriptions. The second criteria is conceptual fit. Ask yourself, will this program or practice have an impact on at least one of our priority risk or protective factors? Programs or practices are a good conceptual fit if they directly address one or more of the priority factors driving a specific substance misuse problem and have been shown to produce positive outcomes for the members of the focus population. The final criteria to consider is practical fit. Ask yourself, is this program or practice appropriate for our community? Programs or practices are good practical fits if they are culturally relevant to the focus population, the community has the readiness and capacity to support it, and it enhances or reinforces existing prevention criteria. You are looking to select programs that meet all 3 of these criteria. They should be evidence-based, targeting the prioritized risk or protective factors, and practical to implement in your community. Evidence-based practices with both conceptual fit and practical fit will have the highest likelihood of producing positive prevention outcomes. When looking to build and ensure a comprehensive approach, there are a few things to consider. Prevention work can target populations at different levels of risk. Universal programs target the general population and are not directed at any specific populations. Selective interventions target those with higher risk of substance misuse, while indicated interventions target those who are already exhibiting risk behavior. Considering all of these levels is vital for effective prevention work. There are also multiple social contexts, and it's a factor that needs to be considered when building and ensuring a comprehensive approach. Risk and protective factors operate across all of these social contexts, including individuals, relationships, communities, and society at large. A comprehensive prevention plan operates in multiple settings across domains, often requiring multiple programs and practices. Cultural relevance is another factor that should be considered in all aspects of our work, and effectively incorporating it into planning can help to ensure that it is integrated into all aspects of our work. This is why defining our focus population is so important. It helps us ensure that we are selecting culturally appropriate and relevant EBPs. Cultural relevance can be applied to the assessment step through data analysis by group and stakeholder identification. It can be applied to the capacity step by engaging stakeholders from the focus population and inviting them to participate in the SPF process, specifically ensuring the planning team includes key stakeholders from culturally relevant groups. During planning, stakeholders from focus populations can help to identify appropriate EBPs, providing valuable feedback on possible interventions. Logic models are an important planning tool. SAMHSA has utilized logic models that list problems and related behaviors, risk and protective factors, interventions, short-term outcomes, and long-term outcomes. Short-term outcomes have an impact on risk and protective factors, and long-term outcomes impact problems and related behavior. Here's an example of a logic model that's related to the PFS grant. If we've identified our problem behavior is tobacco use among individuals under the age of 21, we will then identify some of the risk and protective factors. And maybe when charting them out, we realized that retail access to tobacco had high importance and high changeability. And that is the factor that we're going to target. We're going to target that factor through interventions like compliance checks and merchant education. The short-term outcomes of those interventions should be a reduction in the number of sales to individuals under the age of 21, which is a direct impact on our risk and protective factor of retail access. That should lead to a long-term outcome of reducing underage use of tobacco, which is an impact on our identified problem behavior of tobacco use among individuals under the age of 21. Think of a logic model as a graphic planning tool, almost a roadmap, that can help to communicate the work of prevention efforts and how goals will be reached. Logic models can be very useful for documenting and communicating your plan to the community. They lay out the tasks of development, implementation, and evaluation so that it can be clearly explained what will happen and why. They also identify logical connections between the problems, factors, and evidence-based practices that will affect change. This can help to prevent assumptions or practices that are not evidence-based. Lastly, a logic model helps with evaluation by documenting clear and measurable intended outcomes. This makes it much easier to identify appropriate evaluation questions and data that will be needed. Now we will touch on cultural competence and sustainability. And again, we will note that we are going over these guiding principles at the end of each presentation, but that does not mean they are an afterthought. These principles need to be a focus throughout every step of the strategic prevention framework and integrated into the work. Here are some ways to integrate cultural competence into your work throughout the planning step. You can make community representation in the planning process a priority. Involve members of the focus population as active participants and decision makers. Identify and prioritize risk and protective factors that are associated with disparities. Develop logic models that include a reduction in health disparities as an intended long-term outcome. Incorporate effective prevention programs and practices that have been developed for and evaluated with an audience similar to the focus population. When misunderstandings arise, be persistent in keeping communication lines open. Here are some ways that you can integrate sustainability throughout the planning step. Communities should consider the degree to which prevention interventions fit with local needs, capacity, and culture. The better the fit, the more likely that interventions are going to be successful and sustainable. Sustainability in the planning step ties back to building and ensuring a comprehensive approach. That's going to wrap up our presentation on the planning step of the strategic prevention framework. The next presentation will cover the implementation step of the SPF in relation to the community health assessment process. Thank you.